All right, this month we are turning your attention to heart awareness. We're going red because it is Go Red Month. You know, heart disease is the #1 killer of women in America. Arizona, of course, in those statistics as well. And every Friday this month, we feel it's extremely important to be discussing this issue and reminding you that you need to make your heart health a priority, not only in February, but throughout the year. And so we're going to be doing various types of segments, and today we're turning our attention to all the myths and getting a really good foundation about the disease as we start out this Go Red Month, and we want to find out who it affects. So we asked our friend Dr. Jeffrey Greenberg, who is an expert in this area, a cardiologist, and we asked him to come in and kind of debunk all the myths and have a real straight talk with us. Welcome to the show. Thank you for being in here.
Thank you. Happy to be back.
Yes, it's such an important issue that I actually pulled this out of the newspaper on Sunday, I believe it was. You know, the First Lady of the United States of America is making this one of her great missions to kind of educate Americans, and women in particular, about heart health. That tells you it's a pretty big deal.
It's a very big deal. In fact, it's a big part of Go Red for Women from the American Heart Association as far as educating and empowering women on heart disease. Because, in fact, it is the #1 killer of women. In fact, it kills more women every year than all types of cancer combined.
Well, okay, how do I say this? Why is it that there is such an emphasis then on breast cancer when really the women who are dying are actually dying of heart disease? How do you explain that?
A big part of it is just publicity. There's a lot of publicity on breast cancer. You see it all over the news. But in fact, a woman is 10 times more likely to die of cardiovascular disease than she is of breast cancer. So it's just a much larger problem, which is why we're here and why there's stuff in the newspaper to educate women and empower them so they start learning about it and get treated for it.
When is the average age for somebody to die from this disease?
It can happen to women of all ages, women in 40s, but more likely women in their 60s and 70s.
Well, maybe that's a component, too, of the fact that people don't really address it as much because they're slightly older than some of the younger breast cancer patients that may even be in their 20s and 30s.
That's very true. Cardiovascular disease is a progressive disease. It builds up over time. So from years of having risk factors such as high blood pressure, high cholesterol, diabetes, blockages build up in the arteries and cause problems later on.
Okay, so let's talk about some myths. What are women thinking out there that you are here to say, stop thinking that way, that is not true?
Well, the biggest myth is that it doesn't involve them, that they don't need to be concerned about it, that they don't need to look into their risk factors such as high blood pressure, high cholesterol, things like that. They need to be aware of their risk factors. They need to get tested for it and treated for it. The earlier they get treated, the more likely they are to do well for longer periods of time.
Let's talk about testing. How do you do that?
Well, initially, go have your blood pressure checked.
Okay.
These days, it's so easy. You can go to your doctor, you can go to the drugstore, put your arm in one of the machines.
One of the ones at Costco, I think they've got it.
And what's important, a normal blood pressure is 120/80. That's whether you're 5 or 105. There's sort of a myth out there that as you grow older, it's normal for the blood pressure to go higher, and that's not true.
120/80, that's the number that we're shooting for.
Yep, the top number is the systolic, the bottom number is the diastolic. And once it gets over 140 on the top and 90 on the bottom, you've got high blood pressure, and you need to get it treated.
High blood pressure, as you just mentioned, is a precursor to heart disease.
Absolutely. Heart disease and stroke. Okay. And it's critical that you get treated. The good news is there's lots of treatments for it. There's lots of natural treatments for it. The easiest thing a woman can do today to treat themselves is go out and exercise. Go out for a walk tonight. It's something a woman can do tonight to help herself.
Okay, so let's talk about statistics. Like if I go for a walk 5 times a week for 30 minutes, or even, say, 20 minutes, how significant is that going to be in the reduction of my chances of getting heart disease?
You can definitely reduce your risk of both heart attack and stroke. You can reduce your blood pressure, you can reduce your cholesterol, you can reduce your blood sugar if you're a diabetic. So getting out and exercise is critical. So we're talking about exercise, we're talking about aerobic exercise. Getting out, walking, treadmill, elliptical trainer, swimming. In fact, I've got a lot of patients, older patients, who like to go out and dance. And they'll go out square dancing several times a week.
Wow, I think I want to hang with them.
and they love it, and it's great. They're in terrific shape, they're healthy, and they love it, and it's fun.
All right. So it seems that we've been saying this message for years. We've had this Go Red, the red dress pin that signifies, heart health. I don't feel like there is a major movement to change behaviors, and I don't understand that. And maybe as a physician and a cardiologist, you can offer some insight into that.
And again, that's sort of why we're here. It's what the American Heart Association is about. It's what the Go Red for Women movement is all about. It's about educating women, empowering women so that they know about it, they know about the risk factors, they understand it, and again, get treated early and get evaluated early before they develop problems. The key really is prevention.
And I just have one more question before I let you go, because I know you're very busy. We're so thankful that you cleared your schedule for us. But what about the cases, and we've heard them before, or maybe it's a friend of a friend, where somebody that was in perfect health, they were maybe a marathoner, or they were very active and healthy, and all of a sudden they die of heart disease. What is that? Or heart attack?
A big part of it is a lot of the risk factors we were talking about. People don't feel. You can't feel when you have high blood pressure. You can't feel when you have high cholesterol. Or if you've got a very strong family history, meaning your mom, your dad developed disease early, these aren't things you feel. So you can be feeling great, but things can still be brewing inside of you, which is why it's important to get checked, to get your blood pressure, your cholesterol, stress tests, things like that we can use to evaluate women to see if they have a problem early, even if they feel good.
Okay. And how often should we be testing our blood pressure?
You should be getting your blood pressure checked at least a year. And when most women go in for their annual exams, they get their blood pressure checked, they'll get cholesterol checked, so they can find out their numbers. And truthfully, it's very critical that women know their numbers, their cholesterol, and demand that it gets checked.
Okay. Thank you very much, and we appreciate you kicking off Go Red Month for us here on Sonoran Living.
Thank you.
All right.